Welcome to the podcast of the Journal of Child Neurology. This is Dr. Allison Christie, a pediatric neurologist in Portland, Oregon, and editor-in-chief of the open access journal Child Neurology Open. Today's podcast is aimed more toward medical students who might be thinking about pediatric neurology as a specialty. We're going to talk about how someone becomes a pediatric neurologist. I'm talking today with Dr. Rachel Gottlieb-Smith, who is a pediatric neurologist and also the program director for the pediatric neurology residency at the University of Michigan in Ann Arbor. Welcome.
Thanks so much for having me.
So you are taking over the role of program director. So you can tell us a little bit about how a person becomes a pediatric neurologist. Let's start with just what does the residency usually look like? What are the basic parameters of that?
Yeah, there are several paths to becoming a pediatric neurologist. The most traditional path is applying in the fourth year of medical school into a 5-year child neurology residency program. These programs generally include 2 years of training in general pediatrics up front, and then 3 years of neurology, which includes a total of 1 year of adult neurology and 2 years of child neurology that can be intermingled. There are certain programs that offer a basic neuroscience research pathway that includes 1 year of basic neuroscience research in lieu of the second year of general pediatrics. And if a pediatrics resident decides later in residency that they would like to pursue child neurology, there are also advanced positions that include the 3 years of neurology training after completing a pediatrics residency.
So generally it's 2 years of pediatrics and then 2 years of child neurology and 1 year of adult neurology. And what does that look like for you at University of Michigan?
At the University of Michigan, the 2 years of training in general pediatrics provide a broad exposure to pediatrics through inpatient, emergency department, and intensive care experiences, as well as outpatient experiences, such as in developmental and behavioral pediatrics. Beginning in the second year, residents begin a child neurology continuity clinic that will continue throughout the rest of the years of training. At the end of the second year, trainees complete a month-long boot camp with the adult neurology residents, which prepares them to enter the neurology years. The third and fourth years, which are the first and second years of neurology training, involve a mix of inpatient and outpatient child and adult neurology rotations. The final year is mostly child neurology. Beginning in the fourth year, residents function as senior residents on the child neurology consult service, and they really run the service.
And you did residency yourself at the Children's Hospital of Philadelphia, am I right?
Yes, that's right.
Was it different for you there than it is at University of Michigan?
I think overall the experiences at different institutions, all of the institutions that are accredited at the ACGME, the Accreditation Council for Graduate Medical Education, are pretty similar in terms of their structure. There are some different nuances in the way that the rotations are structured in terms of child and adult neurology and the differences in the way the years of training are, but overall the structure is fairly similar across different institutions.
And what about electives and research? How much independent, how much can you change your residency if you want it to be a little bit different?
There's a little more wiggle room in the fourth and fifth years typically of child neurology training. And in those years, you can have different electives that are both clinical and research-based. So I think most programs have about 6 months of elective time on average.
Is there any research requirement at all?
There is a longitudinal project that most residencies have throughout the curriculum.
And at your institution, do most residents then go on to fellowships like studying epilepsy or neuromuscular or movement disorders?
It's a mix, but yes, generally most residents pursue fellowships after the residency training.
So what do you do as a program director? How do you help guide students in this, or residents in this pathway?
That's a good question as I transition into this role as residency program director. I think the big picture is to make sure that the program runs smoothly. So that includes overseeing the overall education of residents and students making that transition, including the curriculum and evaluation. It also involves program management, including program evaluation and continuous improvement, and program accreditation through the ACGME. And I think the most important role is overseeing resident well-being.
Tell me about what that means to oversee resident well-being.
Yeah, I think resident wellness has become more in the forefront of graduate medical education, and it's been more of a something that people have been aware of, that burnout is real. And I think many programs have mentoring programs and wellness programs that are aimed to improve resident well-being and wellness throughout the 5 years of training. So in our institution, we recently implemented a new and a kind of upgraded resident mentoring program that starts in the PGY 1 year of training.
That's so important. I know from my own residency, especially during the adult time, when you're kind of separate from the people that you knew in pediatrics and also the patients that you knew in pediatrics, that can be particularly challenging.
Yeah, agree. And I think there are different ways to bring residents into the child neurology community when they're in the general pediatric side and also in the adult neurology side. And it's important to have integration with both of those programs.
So, if you are looking at a medical student's application for a child neurology residency, what would you be looking for? What would you like to see?
We look for curiosity, caring, and commitment. I think those are three good words to describe what we're looking for. We're looking for someone who's well-rounded, will be a good team player, and will also continue to think independently. We welcome students from diverse backgrounds and a broad range of experiences and career goals, and we aim to design a program in residency that will fit their needs.
How important is it to have a lot of experience in pediatric neurology before, to have done away rotations or that kind of thing in pediatric neurology?
I think there's limited pediatric neurology exposure at certain institutions, and that's okay. It's not a requirement to do an away rotation in child neurology. I think as long as people have thought carefully about their decision, it's helpful to have some exposure so you know that that's what you want to go into as a student, but it's not a requirement to do an away rotation. And I think generally getting exposure at the institution to neurology and pediatrics and that intersection would be fine. Of course, if you are able to speak with a child neurologist, get a better feel for what they do on a day-to-day basis, that would be helpful just in terms of knowing that that's what you want to do in the future.
And if I'm a medical student and I'm thinking about which residency programs to be looking at or trying to decide between residency programs, what do you think are the important things to look for? And what should I ask about when I talk to people in the program?
Yeah, this is a place that you're going to spend the next 5 years of your life or possibly longer. So I would look for a program where the residents are happy and they're fulfilled, where the faculty is really supportive, and is a place that you'd like to live for the next 5 years or more. And just to plug, because of virtual interviews, it's really hard to get the feel of a place from a virtual interview. So ask for resources that help you get to know the area. That's really important. Another aspect of the program to think about is the size. The different child neurology programs vary in terms of how many residents there are per year, and there are pluses and minuses of having smaller versus larger programs. So get a feel from the residents of what that's like at their institution. And then other questions to ask are about the culture, the relationship with pediatrics and adult neurology, the structure of those 12 months of adult neurology, because I mentioned they can be different across different institutions, the opportunities for scholarship and those longitudinal projects we were talking about, and what residents do after they graduate. I also think asking about what the faculty and residents are most proud of or like most about their program and what are any weaknesses of the program is always helpful.
You mentioned the pros and cons of a small program versus a larger program. I went to the Oregon Health and Sciences University, which was a smaller program. Can you talk a little bit more about what benefits you might get at a larger program, or what those pros and cons might be?
Yeah, that's a good question. I think at a smaller program, there is maybe one or two residents per cohort, so you have a smaller cohort of residents that come through, but you may get to know the faculty a little bit better because it's a smaller institution, so you may have more experience with the same faculty over and over again. Versus at a larger institution, there's more of a larger cohort of residents. There may also be more faculty, but you may have more interactions with the larger number of faculty, but less with each faculty themselves. You may have a little bit more flexibility at a larger program in terms of vacation time, but that can really depend. And so I think it's important to ask those questions.
Excellent. Do you have any advice for non-traditional students, like medical students who have kids or who didn't do quite as well as on the STEP exams, but might be looking at pediatric neurology? Or I know we have a lot of international medical school graduates who are interested in these programs.
Yeah, for medical students who have kids, if you feel comfortable, I would ask the residents with kids in each program to see what their experiences were like. Thinking about childcare and or school systems in the communities that you'll be living will be important. For those who didn't quite do as well in the STEP exam as they would have hoped, I'd address it up front, either in your personal statement or in the interview itself. Why was that the case, and what have you learned from that experience? I love when applicants tell me their stories about resilience and grit. And for international medical graduates, think about credentialing and licensure requirements early on, and make sure to check about program-specific requirements. The websites for each program are often excellent resources.
Excellent. Anything else you can think of that we should know about applying to pediatric neurology residency?
I think that we're just really excited that the students are thinking about applying to child neurology residency, and we're looking forward to meeting them all.
I agree. I think it's the best thing to do.
I agree, for sure.
Thank you so much.
Thank you. Thanks, Dr. Christie.